Okay, thank you for joining us this afternoon. My name is Karen Curtis, and I am a Provider Outreach and Education Specialist here at WPS GHA. Today, I'm joined by my good friend Aline Sigler. My friend Tom Ryan and Mary Muko are also on the line. Aline is my co-host today, and she's going to be monitoring the chat for questions, as well as providing you with some additional information and links throughout the presentation. Now, the portal changes went live on October 12th, but today I'd like to give you some more details about those changes and where you can find things. Here's where I would usually tell you to go to our training center to download a copy of the presentation, but today that's not going to be helpful. We normally post our presentations a couple of days in advance so that you can download them ahead of time. This is also where you can find a list of our upcoming events with links for registration. And our training center also contains a web page for our encore presentations. So videos are available for up to 90 days, and they can be watched on our web page without you having to go to YouTube. We know that there are some of you who may not be able to access YouTube from your company computer, and we wanted you to be able to receive the education that you're interested in. Now, today's presentation is being recorded, and if there are no technical issues, this will be posted to our website soon. Later, there will be a question and answer session if time permits. If you have any questions related to today's topic, please send those using the chat. If there's any questions that I don't get to, or if it requires some additional research, then an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want to know how we are doing, so later in this presentation, you'll be given the opportunity to fill out a survey. This is your chance to let us know what we are doing right, and let us know if you feel that there's areas where we can improve. It also gives you a chance to give us input on what type of education you would like to see in the future. And while this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you ask for. Here at WPS, we do our best to provide you with accurate, up-to-date education. If you have worked in Medicare for a while, you know that Medicare rules and regulations can change. So for this reason, the CMS website should be checked for updates, and the federal regulations are going to take priority over anything that we present. Now, recording of this webinar is prohibited for profit-making purposes, and as I had stated, we're recording it, so you'll be able to see it whenever you want. Today, we're going to look at the changes that were made to the portal, as well as what has remained the same. We'll also give you some resources that can help you find the help that you need. The screen shown today is how the portal looks for an NPI administrator. So if you're a standard or an eligibility user, then your options may look a little different. I've also noticed that the portal user manual continues to be updated. So if you've gone out there and maybe there's something that you couldn't find, you may want to go and check again. It may be updated. There was a lot of work that our portal team had to go through. So I have noticed little things changing as time's gone. So let's start out with the changes. What were the reason for us to make changes to the portal? Well, it was feedback from you, the users. You told us that it took too many steps to perform actions. So our response is to bring functionality to the forefront. You told us that there was too much hunting around to find what you were looking for. So our response is to reduce the number of clicks it takes to perform actions. You told us that you were getting lost in the process flow. So our response was to provide consistent actions. Now here's the new landing page. Now, I don't use the portal every day for work, but to me, this looks a lot more visually appealing and user-friendly than the old landing page. The sections are categorized to be more user-friendly, and the available options pertain to the category title. We'll go over each of these categories in more detail in just a few minutes, but you can see that providers have their own category titled Practice. There is a separate category related to beneficiary inquiries. We've broken out transactions, finance, and notifications. You can also see that some of these options give you notifications so that you know that there's new information available for you to review. Now, if an option has a plus sign next to it, then users can add information or documentation. Otherwise, the button serves more as a search function. Under the practice column, the first option is My Profile. This is where you can update personal information and billing provider credentials. You can also find your recertification date here. Options under My Profile allow you to change your password and security questions, request NPI access. You can handle blackout NPIs, or you can even disable your account in a case where maybe you change jobs and you no longer need access to patient eligibility or claim information. The next option is outlined in red because it's only going to appear if you are an NPI administrator. This option allows the administrators to view users, approve access requests, reactivate disabled users, and unlock user accounts. Selecting the plus sign allows the NPI administrator to add new users. Now, detailed instructions on this process can be found in the portal user manual. Well, clicking on the plus sign next to customer service allows users to send an inquiry to our customer service team. A form will appear that will allow users to select whether their question is technical or non-technical. Technical questions include adding or removing service locations and user access. Non-technical would include policy or claims questions. Staff has 45 business days to respond to inquiries and cannot give claim status or eligibility information that is available on the portal. If you would like to search for an inquiry, this can be done by clicking the customer service button. The credit report is an option that is only available to Part A NPIs. When I say Part A, I mean if you submit claims using a UB04 or an 837I electronic equivalent. This option allows facilities to report any improper or excess payments that they received as a result of billing or claims processing errors, which need to be refunded to the Medicare program. The plus sign allows for credit balance submission, and providers can submit for the previous 2 quarters. Clicking on the credit balance report button allows users to search all reports that have been submitted. There are also several options to narrow your search, such as tracking number, status, and fiscal year end, just to name a few. The 835 enrollment change, if you click on the plus sign, this allows providers to submit an electronic remittance advice enrollment application or change requests to our EDI department. If assistance is needed in completing the form, then you are going to want to contact our EDI department. Clicking on the actual wording, the 835 enrollment change, that allows you to search for requests. So numerous fields will appear, and that's going to allow you to refine your search. The next column is for patient information. This first option shown is the beneficiary NBI lookup. Now, providers should always try to get this information from the patient or the representative. There could be situations where this just isn't possible. Maybe the beneficiary came in alone and they were unresponsive, or maybe they were picked up by an ambulance and they didn't have their purse or wallet with them. So if you're unable to obtain the information directly from the Benny, then you can use the NPI lookup tool. If information is entered correctly, the portal will provide the NPI and you will be given the option to view claims, prior authorization, or appeals. There is a finalized claim summary to view a single Part B claim summary. You will also be given the option to check eligibility or view the patient's supplemental insurance information. The eligibility button provides eligibility information received from the HIPAA eligibility transaction system known as HETS, and users will need the patient's NPI, first name or date of birth, last name, suffix if applicable, starting and ending dates of service. The eligibility info is going to correspond with whatever dates were entered, and you can search 4 years in the past or 4 months into the future. Issues with viewing ineligible dates has been reported. We were told a couple weeks ago in our POAG meeting that some providers were checking for eligibility, and if a beneficiary had been maybe, let's just say, incarcerated and they had an ineligible period, they weren't able to see that. So that was reported to our portal team, and they were able to recreate it, and they are creating a fix to get that worked out. The transaction section is where you, the provider, can take actions on different items. The plus sign next to prior authorization allows users to submit prior authorization requests and upload documentation that supports medical necessity. Clicking on the prior authorization button allows users to monitor status and view decision letters. The prior authorization exemption allows providers to view exemption letters and withdraw from the exemption and withdraw from the process. The claims section covers a lot of different options. If you're a Part B provider and you submit claims using the CMS 1500 or 837P, you can click on the plus sign next to the claims button in order to enter claims. If this is your first time, you will be prompted to register for claim entry through the portal. Claim status inquiries can be performed by clicking the claim button. After entering the NPI, NBI, and dates of service, claims meeting the criteria will be displayed. Depending on the type of claim, further actions that will be available include finalized claim summary for Part B providers, overpayment claim adjustment, clerical error reopening, respond to an additional documentation request, download a remit, request a redetermination, and check patient eligibility. Clicking on the plus sign next to medical documentation allows you to submit documentation for pre- and post-payment reviews, documentation for PWK or responses to 5601 requests should not be updated in the portal. Our website does contain a PWK cover sheet to fax or mail your documentation, and the physical address is also located on this form. The address for mailing 5601 requests can be found on our website by selecting Contact Us and then choosing Claims Processing, Claims Submission in the Contact drop-down box. Selecting Appeals allows you to search requests that had been previously submitted. This section also allows you to upload documentation and request a reconsideration. Requesting an appeal through the portal requesting an appeal through the portal is done under the claims function. The next button is appeals, reconsideration. This allows users to find the status and outcome of reconsiderations that have been submitted through the portal. This last button, this ACO Reach, I couldn't find a lot of information on it, and what it stands for is Accountable Care Organization Realizing Equity, Access, and Community Health Model. I was able to find information regarding this model on the CMS website, but I couldn't find anything in the portal manual as to what this button would do, so I apologize for that. Now, finance includes items that affect your payment or ways to provide money back to Medicare. To get information from the refunds option, you will need to know your group's banking information, and it must match the group's electronic funds transfer authorization agreement. The plus sign allows new refunds to be submitted, while the refunds button allows you to search refunds that were previously submitted. The receipt option allows the user to search for receipts submitted via e-refund, wire payment, or paper check. You can also search for e-refunds submitted in the portal, or you could submit a new Medicare e-refund. Overpayments can be searched using demand letter, transaction, or claim number. The information returned when searched by letter number includes the original principal amount, the principal activity amount, principal balance, interest accrued to date, interest activity amount, interest balance, original fee amount, fee activity amount, fee balance, and total balance. Now, when you search by using a transaction or a claim number, then there's even more information provided. So just be aware that depending on how you search, that could affect the results you get. Payment status requires users to enter their NPI and data service from and to dates. Payment results that match the criteria will be displayed. The AP Hold button allows you to receive real-time status and resolution guidance for accounts payable holds on your service location. The last column is Notices, which will allow you to find all correspondence from us in one place. The screenshot that we received also shows that you will be notified when new correspondence has arrived. Remittance Notices is where you can view and print your remittance advices. This option is also available under the Claims option. You can review all remittance advices issued within the last 30 days. You can also search for specific remittance advices or ones that are issued more than 30 days in the past. Next, we have the additional documentation requests, also known as ADRs. Providers can use the portal to view ADR letters for up to 90 days after WPS has issued them. Responses can be sent through the portal, but it is not required. Finally, we have demand letters. Like the ADRs, these can also be viewed for up to 90 days from when the letter was issued. The portal may also be used to respond to demand letters, but it is not required. Less pages are something that will also be available with the portal redesign. So as you can see from this screenshot, when the NBI lookup is selected, the fields appear at the bottom of the screen. So instead of taking you to a brand new page and having you enter information, it just stays right there. So I've told you what's changed, so now let's discuss what's staying the same. The login process has not changed. The box was moved to the top of the landing page when we redesigned the public side of the website, and it has remained there. It'll also remain on each page until you choose to log into the portal. The functions available in the portal will remain the same, but it just has a different look and feel. The new portal is much cleaner. The options have been organized in a way that makes more sense, and it's more user-friendly. The certification and recertification process has not changed. NPI administrators are responsible for letting users know when it is time to recertify. The NPI administrator role has not changed. NPI administrators facilitate access to the portal for other users within their organization, and they ensure that those users abide by the rules and regulations set by WPS. If this is something that you are interested in doing, please check out the section of the user manual titled NPI Administrator Responsibilities. That way you kind of have an idea of what's going to be expected, you know. The last topic I'd like to talk about today is where you can find help if needed. First is the portal user manual. A link to the manual can be found in the user login box under the login button. There's also a link under all tools. So this option can be found by clicking on the down arrow next to tools at the top of our website. So this arrow right here. There is an additional link at the bottom of the page under educational opportunities. And like I said, there is still updates being made. So if you looked for something and didn't find it, be sure to go back out and check because it could have recently been updated. I've mentioned the NPI administrator a couple times during this presentation. And this is another level of somebody that can provide help for you. A link shown on this slide will take you to the NPI Administrator Search. The web page will ask you to enter your NPI, PTAN, and tax identification number, and then the system is going to provide you with the administrator's contact information. That way that you can reach out to them for additional help. I do want to take you also to the website. Aline, can you verify that you can see the WPS website?
Yes, I can.
Okay, great. So if we go up here to the system notifications, there has been some bugs that have been reported. Here's one for the Part B appeals. When checking the status, things might not display correctly in the portal. There were some issues involving ADRs in the portal. Not all ADRs are available. There's currently an issue with the number of units entered in the claim entry form after submission. So this will just be something that if you do find that you're having issues, if you go out to our website and check, they're logging these. I know we had gotten some emails. I think there was something with CERT data and maybe something with ADRs with uploading documentation, but I don't see those out there now, so that I'm assuming that has been taken care of. Okay, I know I presented a lot of information in a short amount of time, but I want to check with Elaine real quick to see if we'd had any questions that have come through.
Hi, Karen. Thanks for that. I know this is an exciting time and there are, issues that present themselves, but they are actively working on all those. We did get a couple comments, and one is from Robin, who says that she's having trouble with the medical documentation, that the ADR is blank, and that is one of the issues that you just showed to us. So we are aware of that. They are working on that. And then the other thing is that when trying to print things, like one is related to the ADR, one is pressing print for the supplemental part. So it sounds like that print option might be an issue as well. So make sure you bring that to customer services attention. I'm assuming they probably are actively working on that. We just got another question that popped in. When searching for a reconsideration that was submitted on the portal, is there a way to change the subcategory box? Mine has Part A Appeal Level 2 in the box, and I can't click in to remove or change it. I'm not sure if you can address that or not.
Sorry about that. I was talking on mute. I can look into it. If you wouldn't mind sending that question in to the WPS education mailbox, and that way I can take a closer look at it. We don't have access to the portal, so I may have to ask somebody that does have access and kind of see what we can do with that. But I will definitely try to get that question answered for you.
All right, thank you. And the other question that we got a follow-up that said, sorry, I figured it out. So, okay, sorry, I'm reading these as they come in. Are the Part C benefits still able to be viewed in another area? And is there a place to see SNF days used?
That will be covered. We're going to be doing some eligibility webinars, and that will be covered in those webinars. Yes, that information is available, and I'll be holding those webinars, so I will show you where. And since we are getting close to the cutoff of time, I'm going to end the questions there. If anything else comes in, I'll try to get those answered through emails. Now, in an effort to protect Medicare beneficiaries from fraud, CMS has issued CR 13754, directing MACs to disable the beneficiary eligibility function from our IVR systems. WPS has made the decision to end our IVR eligibility function on January 1st of 2025. Now, there are other options which are listed here. Direct data entry, or DDE, is an option that is only available to providers who use the FIS system, but we will be holding multiple webinars in the future, and we're going to show you how to get the information with this being disabled. After the close of today's webinar, you're going to receive a thank you for attending email. This is where you're going to find your proof of attendance and contact hours in case you need to send that to accrediting to get your CEUs, I'm sorry. If you do not get this email, please check your spam or junk folder, and you will also need to add messenger@webex.com to your safe sender list. Now, if you joined by phone, that you will not receive this email. So please send an email to the education mailbox and provide that the phone number that you use to join, and that way we can get a certificate sent out to you. If you do have any follow-up questions, you have 7 days to send those in. You can email those to our education mailbox shown here on the screen, and be sure to put today's topic in the subject line so that staff will know your questions related to this webinar, and they will send it directly to me. Now, when you disconnect from this webinar, you will be redirected to a CMS survey. I'm also having Aline add it into the chat. Your feedback really does mean a lot to us, and we really do want to know what we can do better, what we did that you liked, and what you want to learn in the future. Now, this brings us to the end of today's presentation. So on behalf of myself, Aline, Tom and the rest of the provider outreach and education team, I would like to thank you for being here today, and I hope that you'll join us for future events. You can now disconnect.